is my pleasure to welcome you to today's session on Medicare Made Simple, what providers and caregivers need to know. We're excited to bring you this direct-to-learning event where you can watch this program at any time, self-paced, depending on your availability and schedule. My name's Rachel Browner. I am one of the program coordinators with our OneOp Lifespan Caregiving team, and I'm just excited to be here today. We have a great presenter for you and a lot of good information as we talk about Medicare, the different parts of Medicare, and some resources for providers and caregivers. Please note that the slides and resources from today's session are on our event page, which will share that QR code at the very end. So stay tuned. We're also going to be discussing some continuing education credits or certificates of attendance for those that are needing that information, whether you're a provider supporting caregivers or just a busy professional that's needing a certificate of attendance to provide to your supervisor. So stay tuned at the very end. We're going to be providing that information to you. Thank you for joining us as we continue our partnership with the Department of Defense, the U.S. Department of Agriculture, to expand the readiness, knowledge, and networks of the professionals supporting our military service members and their families. The views expressed in this presentation do not necessarily reflect the official policy of the War Department, U.S. Department of Agriculture, U.S. Government, or OneOp. The mention of any entity or product is for informational purposes only. I'm excited for our presenter for today's session. He is not new to OneOp. He is actually one of our OneOp team members. But Dr. Andrew Crocker hails from Texas A&M AgriLife Extension, where he is an associate professor in Extension health specialist for our aging populations, and a lot of his role is really to support extension agents out in the counties throughout the state of Texas. Without further ado, I'd really like to go ahead and pass the presenter reins over to Dr. Crocker.
Hi, I'm Andy Crocker, an associate professor and extension health specialist with Texas A&M AgriLife Extension Service and part of the OneOp Lifespan Caregiving team. And I'm glad to be able to share with you a little bit about Medicare and what providers and caregivers need to know about a very familiar but sometimes confusing federal program that provides health insurance for individuals of a certain age and people with certain medical conditions. So today we're going to talk about Medicare benefits, and we're also going to talk about the coordination of those benefits. We're going to try to answer some of the common questions that people have about the Medicare program, and then we'll also provide you some resources at the end where you can learn more about Medicare and how Medicare impacts the lives of older adults, their caregivers, and the professionals who serve them. So what is Medicare? Medicare is a health insurance program for adults over the age of 65 and people with certain medical conditions. When I do this in a live setting, I usually ask the audience if Medicare will pay for a pregnancy test, which kind of gets a lot of people confused, right? Because Medicare is something for older adults, and pregnancy may or may not be something that they're concerned about. But there are people with other medical conditions who are not age 65 and older who qualify for Medicare. So people with amyotrophic lateral sclerosis, which is also known as Lou Gehrig's disease, people with end-stage renal disease, people who meet the definition for disability under Social Security may all qualify at any age. And so the answer is yes, Medicare will pay for a pregnancy test if it's medically necessary for someone who's having something done, and that's a necessary test for them. Medicare is administered through the Center for Medicare and Medicaid Services, which is a federal entity, but it's actually it's a partnership with the states to administer parts of Medicare. And we'll get into that a little later in this session. And enrollment is done through the Social Security Administration. So you find a lot of people who are paying for certain parts of Medicare through their Social Security benefits. And then if you're a railroad retiree, you're getting that enrollment through the railroad retirement system. And I think we have a question related to Medicare enrollment. So let's go ahead and take that question now.
I take care of my aging parents. When should we enroll in Medicare, and what are my options?
It's a great question and a really common one about when do I enroll in Medicare? Again, most commonly, people are enrolling in Medicare around the age of 65. If you have one of those other diagnoses that qualifies you for Medicare, certainly you'll do that on what's known as a special enrollment period. But your initial enrollment period, so let's say you're just run-of-the-mill turning 65 and you want to enroll in Medicare, your enrollment window actually begins 3 months before you turn 65. So I happen to be a January baby, which when I get to be close to 65, my initial enrollment period would start December, November, October. So 3 months before the month I turn 65. So about October of the year before I turn 65, I'll start getting some information about enrolling in Medicare. And then I'll have that 3 months, the month I turn 65, and then 3 months after 65. So if we count that, that's February, March, April. So I'll have an October to April window to enroll. And that's important because if I don't enroll when I'm initially eligible, there may be penalties or other hiccups along the way, and it also may delay my coverage. So if I enroll in October, November, December, or January, then my coverage goes into effect the first day of the month after I turn 65. So I can expect coverage on February 1st. However, if I delay my coverage delay my enrollment until later, my coverage won't actually start until the first day of the month after I enroll. So it is really important to pay attention to some of these enrollment deadlines. I know as adults start to get close to 65, they're bombarded with information from a lot of people wanting to help you enroll, and you need to enroll, and you need this supplemental coverage and whatever else. But it is important to pay attention to some of these deadlines, cut through the noise a little bit to make sure that you're getting enrolled when you're eligible so that you aren't penalized later in the benefit process, and then also that you're not experiencing a delay in coverage. So it's a really great question and one that a lot of people have. You also may be able to qualify for Medicare based on a disability. And if you do qualify for Medicare based on a disability, you're going to get information from Social Security regarding that, and your coverage will kick in basically after the 30th month of being designated disabled by the Social Security Administration. So you have a 24-month basically period for Social Security to determine a disability, and then you'll get coverage on the 30th month after that determination is made. So the process to qualify based on a disability is a little long because you've got to go through that Social Security process, and you've got to have the waiting period for Medicare. But hang in there. It will come, and Medicare based on a Social Security disability is actually quite common, and the system works. It just takes a little longer to process than it normally would otherwise. One of the common things that I get questions about is the difference between Medicare and Medicaid, and I think we actually have a question regarding that.
I plan to retire from the Texas teacher retirement system in about 7 to 9 years, and so I want to know the difference between Medicare and Medicaid.
So are Medicare or Medicaid the same program? Really common question, and the simple answer is no, but because I've got a little time, I'll go ahead and share a little more information with you. Medicare is a nationally standardized, basically, health insurance program, as we've already talked about, for older adults and people with certain health diagnoses. It's administered by the federal government. There are some partnerships with the state to do certain things, but it is basically a federal health insurance program that works the same in all 50 states and all the U.S. territories. And it is the nation's primary payer of inpatient hospital services for older adults and people with certain conditions. Medicaid, CAID, is a federal and state partnership to provide health insurance for individuals who meet certain income and asset requirements, okay? So Medicare, CARE, basically health insurance for older adults. Medicaid, CAID, is a health insurance program for people who meet certain income requirements. And it's actually a federal and state partnership. And so Medicaid, you're going to find varies by state, right? Because the states are able to put into place regulations and stipulations, and they basically are able to run the program like they want to run it with some federal guidance. So they vary wildly depending on the state in which you live, but they're very similar. They're basically administered by the same federal entity, but they are very different programs. And there's a lot of confusion, right? Because especially among older adults, a lot of older adults think that Medicare, CARE, is going to pay for them to live in a residential facility one day, that it's going to take care of them into old age. And that is absolutely not the case. Medicaid, CAID, is what pays for older adults to live in a residential facility. In fact, Medicaid ends up being the largest payer for nursing home placements or residential facility placements in the country. And so very different programs, very different qualifications, but it is actually quite common for people to think that they're the same or that they maybe qualify for both, but that is not the case. Medicare can be a little confusing, as if the difference between Medicare and Medicaid and what the requirements are isn't enough, but understanding the different parts of Medicare can be very important, especially because there are some decisions and deadlines that have to be made regarding the individual parts. And I actually think we have a question regarding the different parts of Medicare.
I am already enrolled in Medicare. I've been for several years, but I'm confused over all the parts. What's the difference, and what are those parts?
Sure. So Medicare has different parts that do different things, and some of them are required and some of them are optional, and understanding that is very important. So we're going to talk about 4 different parts of Medicare. We're going to talk about Part A, which is your inpatient hospital coverage. We're going to talk about Part B, which is your outpatient health coverage. We're going to talk about Part D, and I know that I skipped a letter in the alphabet, but we'll come back to it in just a second. We're going to talk about Part D, which is your prescription drug benefit, and then we're also going to talk about Part C, which is also known as Medicare Advantage. And again, understanding these parts, how they work, what I need to do to enroll in each of them can be critical because, again, there are certain deadlines that you have to meet in order to get the coverage that you need in a timely fashion. So we'll talk first a little bit about Medicare Part C. I'm all over the place with the alphabet right now, and I'm very sorry about that, but we'll come back to it in just a second and get back on track. But we'll talk briefly about original Medicare versus Medicare Advantage, or Part C. So under original Medicare, you basically have your Part A inpatient hospital coverage and your Part B outpatient medical coverage. You may or may not have a supplement. You may or may not choose to have a prescription drug plan. Original Medicare is what you think of Medicare as. It's something that you can use in any hospital or provider office anywhere in the 50 states or the U.S. territory, and you just go on about your day. There's not a whole lot of choices with it. It just works, okay? Medicare Advantage also works, but it works a little differently. In a Medicare Advantage plan, you're basically contracting, or you're subscribing or joining a health plan that is offered by a private insurance company. And that shouldn't scare you, but it also requires you to make a decision. There are some Medicare Advantage plans that work nationally, and that may be important for you. Some are more regional. Some may be limited to a specific hospital or physician group. And so you really do need to do your homework with a Medicare Advantage plan to make sure it's going to work right for you. Medicare Advantage basically offers all the same benefits that Medicare does, but it does it in a different way. And in fact, it may be able to offer more benefits than a traditional Medicare or an original Medicare plan. So again, look at your options. But let's say you look at a Medicare Advantage plan and you live in a big metro area somewhere in the United States. And that Medicare Advantage plan is attached to a particular hospital or health system. You may have to use that hospital or health system's physicians. You may have to use their network of providers. You may have to seek permission or referral to see a specialist. You may have to use a particular group of facilities. And so maybe that works well while you're in your big metro area most of the year, but then during the winter when you go south for sunshine, what happens? You need to check with that Medicare Advantage plan to see how your benefits are impacted if you're no longer in the geographic area of that hospital or health system service area. By the same token, because of the efficiencies that some of these Medicare Advantage plans gain by limiting the type of provider that you're able to see or the facility that you're able to use, they may offer additional benefits. So for instance, Medicare doesn't cover routine vision services like eye exams or prescription eyewear, but a Medicare Advantage plan may have that as an added benefit. Similarly, original Medicare doesn't cover routine dental care, but a Medicare Advantage plan may have some dental services covered as part of your membership. So you really do have to do your homework, and there are people that can help you evaluate a Medicare Advantage plan. And I'm not just talking about the people who are trying to sell you a Medicare Advantage plan or enroll you in their Medicare Advantage plan. There are some neutral, disinterested third parties that can help you objectively look at whether original Medicare or a Medicare Advantage plan is going to be right for you. And towards the end of our session here today, I'll give you a website where you can go and find those professionals in your area. They're not just a handful of them, that you can't go see, but there are people near your location that can help you make these determinations, and we'll cover that. But again, a Medicare Advantage plan isn't inherently bad or wrong. It is offering you a lot of or all of the same benefits that Medicare does, maybe some extras that you're not getting through original Medicare, but it is different from original Medicare, and you really need to do your homework because it may not always be the best option for you. So look carefully at that. And that's actually going to be the last part of what I talk about with Medicare Advantage. The rest of the session is going to focus more on original Medicare because that's what's going to be standardized across all 50 states and all the U.S. territories. And frankly, for something like this, that's the easiest thing for us to focus on and talk about. So under original Medicare, Part A is our inpatient hospital coverage. Okay, and so under Medicare Part A, we're taking care of being an inpatient in the hospital. And this is if you have to go into a hospital room for a series of days, you are covered under Medicare Part A. It also helps cover a skilled nursing facility, which is confusing for some people. This is why people think that Medicare will pay for them to be in a nursing home because, well, it says right here it'll pay for skilled nursing. Think of this more like rehab, right? So you break a hip or you suffer a stroke or something like that, and you need to go to a rehab facility for 6 or 8 weeks or something like that to get back on your feet. That's what Medicare is paying for here, for you to be in skilled nursing to help recover from some kind of illness or operation. It's not going to pay for you to be in that facility long term. It'll help cover some blood and other services while you're an inpatient in the hospital. It helps cover home health care. So if you need services at home to manage a condition or to recover for a condition, it's going to pay for that. And then it also pays for hospice care. Hospice actually gets a bad rap, and ends up being a bad word, but hospice is actually a really functional part of the care system. And in fact, the hospice philosophy is for it basically to cover the last 6 months of your life. I know that we're used to hospice kind of being the last, 10 to days to 2 weeks or something. It's you go home on hospice and then a few days later death happens. But hospice is a longer term process and service, and Medicare Part A pays for those services through as part of your benefits there. Most people don't pay for Part A. And so if you work 40 quarters and pay into Medicare, you're covered under Part A. But if you do need to, if for some reason your work history was a little spotty or you didn't pay in for Medicare taxes for some reason, you can enroll in Part A. But most people just get it as a function of working 40 quarters in the United States. This is an area where you need to pay attention to those enrollment deadlines because Medicare Part A does have some costs associated, and you need to understand that so that you get enrolled when you're first eligible so you don't pay penalties later on in the process. A lot of people think that Medicare is completely free, and a lot of times it is, but there are some costs associated with Medicare, and I think we have a question about costs associated with the different parts of Medicare.
Is Medicare free? If not, what are the costs?
Great question. And because this is an evergreen recorded presentation, we're not going to actually talk about specific numbers, but I will talk to you broadly about Medicare costs. We already talked about Medicare Part A kind of being something that's quote unquote free that you get as a result of your work history and paying into taxes, but there are some additional costs associated with it. There may be an annual deductible that you have to reach, which is a kind of a set level of spending that you have to reach before Medicare will kick in and pay for that. It's typically in the $1,500 to $1,600 range. But if you think about being an inpatient at a hospital, you probably walk through the door and it's already cost you $1,500 or $1,600. So you're going to meet that deductible probably pretty quickly as an inpatient in the hospital. There may be some co-insurance associated with an inpatient hospital stay under Medicare Part A, and this is kind of your part of the health services that you're receiving. Co-insurance is actually quite common across the insurance spectrum, whether it's private or public, and then you'll notice that co-insurance kind of rears its head throughout the Medicare system as well. There are also limits on coverage. And so you may experience after 60, 90, 100 days of coverage, you may experience some differing levels of what Medicare pays. So I get a lot of questions from older adults about, well, I need these services. Why is Medicare making me pay more and more and more of these services? Remember when we talked about the difference between Medicare and Medicaid? Medicare is a health insurance program, and Medicare wants to see that you're getting better, that you're progressing, that you're advancing. It is not a long-term care insurance, okay? And so Medicare will pay for whatever is medically necessary for as long as it's medically necessary, but at some point, those coverage limits start to kick in because Medicare says, well, look, if we're going to go 100 days out and this isn't getting any better, then all of a sudden we're not treating a condition anymore. We're kind of managing a long-term care something, and we're going to need to look at different coverage for that. So don't be scared about some of those longer term and lifetime days. I know it's frustrating and maybe a little disappointing, but it actually is starting to get away from the philosophy behind what Medicare is and what it's for. And so be aware of some of those coverage limits and some of those additional costs that may be associated with them when you start running into those timelines. We've already talked a little bit about how Medicare will pay for a stay in a skilled nursing facility. Kind of the same thing. It will pay for a while, and then it's going to start winnowing down some of those payments because it's not meant to take care of you long term in that facility. And so we'd be aware of those coverage limits, working with your providers and with the people who are designing your recovery plan so that you try to get in and out of there before some of those coverage limits kick in. And then again, there may be some costs associated with home health services that you're receiving. And this is interesting too with home health. I work with a lot of older adults who are frustrated with home health because they maybe need help with their bed being made or with preparing a meal or washing the dishes in the sink, right? Medicare is not paying for custodial care. It's not paying for social care. It's paying for home health care. And if you need that type of custodial care or that social service care, that would be a different program that is either going to be private pay or you'd need to look around for resources in your community that would support that. But I think the takeaway message, especially related to Part A and all the parts of Medicare, is the bulk of it is covered by the program, but there may be some costs for you as the beneficiary, either through a deductible or through some kind of coinsurance or through some kind of disallowed service that you may have to pay for on your own. When we get to Medicare Part B, that's our outpatient coverage. And so this is if you go to your health provider's office, for a wellness visit or because you got the sniffles or whatever else, you need a refill on your prescription. That's going to be covered under Medicare Part B, which is your outpatient health coverage. Interestingly enough, Medicare Part B also pays for you when you're in the emergency department of a hospital, because when you're in the emergency department of the hospital, you're not yet an inpatient in that hospital. And so Medicare Part B is important because it covers you for certain hospital services when you're not an inpatient. It also helps cover some outpatient medical and surgical services, lab tests, durable medical equipment. And by that, I mean like if you need crutches or a wheelchair or a walker, some kind of assistive device, that's durable medical equipment. Diabetic testing supplies, and then it also covers a slew of preventive services. I mean, there's a whole book that's just devoted to the preventive health services that are covered under Medicare Part B. The trick with Medicare Part B is Medicare Part B is optional, okay? So with Medicare Part A, you work your 40 quarters or you enroll in it separately because you didn't quite get 40 quarters in, and it's just there, you've got it. Medicare Part B, you've got to enroll in. And so you look at your options and you make sure that it is right for you. And for most people, it's going to be right for you. I'm not a paid endorser of Medicare Part B, but I'm a firm believer in Medicare Part B because outpatient expenses can get very expensive, and it's a great benefit to have. For Medicare Part B, you will pay a monthly premium, and that monthly premium varies year to year and also may vary based on your income. Okay, so be very aware of how much you make and how much Medicare Part B is going to charge you. I promise you it's probably still a drop in the bucket compared to what you would pay without it, but you still may need to look at that and make sure that it's right for you when you enroll. If you don't enroll when you're first eligible, and this is why it's critical to make this decision, if you don't enroll when it's first eligible, Medicare Part B is going to cost you a little bit more to the tune of 10% higher each year you were eligible but not enrolled. So let's say, you turn 65, you're healthy as a horse, you decide that you don't ever go to the doctor, you don't need outpatient health coverage, and then 5 years later, you're going to enroll where you're going to pay 50% more for the rest of your life. It's a lifetime penalty. And to call it a penalty, how about we call it a surcharge, right? It's a lifetime surcharge that you're then paying because you didn't enroll when you're first eligible. everybody's situation is different. And I know that pinching pennies sometimes makes a big difference, but this is one area where I think prioritize this spending just because it's very important. But again, I'll leave that up to you. Those disinterested third parties that can help you decide whether you want to do Original Medicare or Medicare Advantage can also help you make a determination about whether to enroll in Medicare Part B. But the answer, at least from my perspective, is typically yes. There are some exceptions to this penalty. So, for instance, when I retire from my position, I get to keep employer-sponsored health coverage. Or maybe I decide to work past 65. I get to keep employer-sponsored health coverage. There is a system in place to determine what's known as creditable coverage. I'll say that again, creditable coverage. And you can work with your HR department or with someone in the know in your organization that helps process benefits to get a determination of creditable coverage. And then Medicare will basically waive that penalty if you're able to prove that you had creditable coverage between the time that you were eligible for enrollment and the time that you actually enrolled. So it is important to maintain these deadlines and to know them, but it may not be right for you. And if it's not right for you, there are systems in place to avoid those penalties for enrollment later. The annual, there is an annual deductible associated with Medicare Part B. It varies by year, and so you'll need to look. And part of the question was that we had earlier was, what are the costs and when do they change? And I missed the whole when do they change part, but that's a really important thing. Medicare rolls out changes in the fall. So in September or October of each year, we get notified of the changes that will go into effect January of the following year, right? So be on the lookout in the fall of each year. Medicare will publish what the costs are going to be for various copays, deductibles, premiums that will go into effect in January. And Medicare is actually really good about only announcing changes once a year. So once you're in a benefit year, you're basically, you know what that benefit is going to be all year long. And then in the fall, they're going to announce the changes for the next benefit year. I'm sorry for missing that part of the question, but we got back around to it. And then Medicare Part B actually has a pretty standardized co-insurance rate of about 20%. So you can expect to pay about a 20% copay for services rendered under Medicare Part B. But there are some big exceptions for that. So currently Medicare doesn't charge basically anything. It waives the deductible, it waives the premium or the copay for preventive services. So if you go in to get a vaccination, if you go in to get a mammogram, if you go in to get a prostate exam, if you go in for your annual wellness visit, you're at least currently not going to pay a copay or have to meet a deductible to get those preventive services. And again, we'll talk about it here in a moment when we talk about resources, but there's a whole book of preventive services available under Medicare that starts with A for like a abdominal aortic aneurysm screening all the way to Z, and I don't know what a Z would be in that book. We'll just say zebra trampling, but you'll be able to find all the preventive services that are available to you under Medicare, and a lot of those are going to be waiving those additional costs. When we talk about additional costs, there are programs that help people pay some costs associated with Medicare based on income and assets. And I think that's where this idea of the federal and state kind of partnership comes into play, because each state determines what those levels are. And so they vary year to year. They adjust based on a variety of factors, including inflation and the federal poverty level and what the budget and situation for this type of program is in each state. So you'll need to check with your state-specific entity. Again, we'll talk about it in a moment, but there are objective third-party individuals who can help you screen for this. a lot of times Social Security will just automatically enroll you in these extra programs if that is your main or your only source of income. They already know whether you qualify for these programs. But don't ever suspect that you make too much or you have too much to qualify for extra help under Medicare. There are some pretty generous and permissive allowances for income, which is money that comes into you, or assets, which is things that you have like savings account or a house or a car or something like that, life insurance policy. There's some really generous and forgiving limits to this, but you'll need to check with each state. But it may cover your annual deductible. It may cover your annual or your monthly premium. And so it may waive copays. Just ask, okay? Somebody can't tell you no if you don't ask. And so if you think you may qualify for extra help, or if you just want to try to qualify for extra help, ask someone about extra help. And you might be surprised at what you qualify for. The last part of original Medicare that we're going to talk about is Part D, which is your prescription drug benefit. And Part D works a little differently than Parts A and B, which are basically administered by the Centers for Medicare and Medicaid Services. Part D is actually a partnership between Medicare and private insurance companies to offer prescription drug coverage. Sorry, I'm getting a little tongue-tied here with all of the letters and the prescriptions, but these are plans that Medicare has approved that are offered by private companies. And so you actually need to go to the Medicare Plan Finder online, put in your medications, put in your preferred pharmacy, and make some selections based on what's going to be right for you. Now, the beauty of that is you're only locked into it for a year. And so if you move, if your prescriptions change, if you hate your coverage, you have an opportunity to change that every year. And then there are some special enrollment periods that you can qualify for based on, let's say your drugs change drastically, or you move and you can't use that chain of pharmacies anymore, or your plan doesn't cover you where you are. There are some opportunities to change, but give it a chance. Make sure what works for you in the moment still works for you every year. And again, there are helps out there to be able to get some disinterested, third-party, objective recommendations for these plans. Similar to Medicare Part B, there are some penalties if you don't enroll when you're first eligible. I hear this a lot. Well, I don't take prescription drugs. I just take a vitamin every day, or I just take an aspirin or something like that. I get it. But in those situations, it may make sense for you to enroll in something that's really cheap, okay? Just so you get your foot in the door with a prescription drug plan so that you aren't penalized later in the process when you may need prescription drug coverage some years down the road. The other thing is, so again, going back to like my situation, I will maintain prescription drug coverage in retirement, or I'm still working after 65 and my employer offers prescription drug coverage. There are exceptions for that. Again, you need that letter of creditable coverage or some proof that you had creditable coverage between the time that you were eligible and when you enrolled, and then Medicare is not going to subject you to those surcharges. We're not going to call them penalties. We're going to call them surcharges because penalties sound worse than surcharges. The costs of Medicare Part D will vary by plan. And so you need to be very careful about choosing a plan that's right for you. The monthly cost may be the most important thing for you, and you'll find some plans that have very low monthly costs, but you need to reconcile that with, are there super high deductibles, or are there limits in coverage? And so try to weigh paying a little more or a little less monthly for maybe some benefits later down the road. But It's very important that you pay attention to this and make sure that you're getting the coverage that's right for you. Similar to what we just talked about with Medicare Part B and having additional help for people who meet certain income and asset requirements, there are programs that provide extra help for Medicare Part D coverage. And so you'll find more information about that in your state, because it does vary by state, to see what the income and asset levels are to get additional help through Medicare Part D. Again, if Social Security is your main or basically only source of income, they may already know that you qualify for extra help and can automatically enroll you in some of these programs that can provide that extra help for you.
I'm helping my dad with his retirement planning. Does he need other insurance to go along with Medicare?
It's a really great question. And again, a lot of people think Medicare is just going to take care of everything, and it takes care of a lot of stuff. But as we already discussed, there are some additional costs associated with being enrolled in Medicare. And it may be important for you to look at extra coverage, especially if you don't qualify for one of the income and asset-based subsidies, basically, that help take care of some of those additional costs. There are Medicare supplemental insurance policies, also known as Medigap policies. And so they're called Medigap because they pay in the gap when Medicare won't. I think the important thing to understand about a Medigap policy is a Medigap policy only pays when Medicare pays, okay? So this is not like having private insurance that is providing you additional coverage. It's basically just supplementing what Medicare doesn't. Now, the great thing about Medigap policies is they're standardized in all but 3 states. And that is the Commonwealth of Massachusetts, the state of Minnesota, and the state of Wisconsin. Now, if you live in Massachusetts, Minnesota, or Wisconsin, they're still standardized. They're just standardized for that state. But in the 47 other states, they're basically all the same, okay? And so the beauty of that is, as a consumer, is you can literally compare apples to apples. So you can go to your favorite insurance provider and say, I want to know what your cost is for Medigap Plan A. And then you can go to his or her competitor across the street and ask them what their costs are for Medicare or Medigap Plan A, and literally compare them, because the coverage is going to be the same. To qualify for a Medigap policy, you must be enrolled in Medicare Parts A and B, and then you're also going to pay a separate premium for this Medigap policy, which again, you're able to compare apples to apples from your health providers or from your health insurance providers to know that you're getting the best bet. It's important to understand that there is a guarantee issue period, which means that they cannot deny you coverage based on medical underwriting or any other type of disqualification if you enroll in a Medigap policy within the 6 months after you turn 65. So pay attention to this deadline, because it can really make a difference, especially if you've got some chronic conditions or other issues that may cause some hiccups in getting health insurance otherwise. In that first period, they cannot deny you coverage. And you can find way more information about Medigap on the Medicare website, including what the different plans are, what they cover. Now, there's no cost information because, again, Medigap is offered by a private insurance company that's going to supplement your Medicare coverage, but you can at least see what the different coverage options are. And I'll give you an example of that. And they're, A, B, C, D, E, F, on and on. It may be important for you to have a Medicare supplement policy because Medicare only covers you when you're standing on U.S. soil. Let me say that again. Medicare only covers you when you're standing on U.S. soil. So let's say that you live in the frozen tundra of the Midwest where there are regularly minus signs in front of the temperatures on the weather through the winter. And to combat that, you decide that you're going to spend your winters on the beach in Mexico, which just sounds delightful, and I wish I spent my winters on the beach in Mexico. Something to aspire to, I guess. Anyway, Medicare covers you when you're in the frozen tundra with those minus temperatures. Medicare doesn't cover you when you're on the beach sipping something out of a coconut in Mexico, okay? But there are some Medigap policies that cover foreign travel. And so let's say you're not even doing the Mexican winter thing, you're just going on a cruise or you're going to Europe or something like that for 2 weeks. Medicare doesn't cover you when you're in Europe for 2 weeks, okay? But you will find some Medigap policies that pay for foreign travel emergencies. And if that is part of your lifestyle, then that might be important for you to consider as far as a Medigap policy. So look at those carefully, compare apples to apples with different providers in your community, and then make a good decision as far as what's right for you. There are a couple of resources that I recommend for Medicare beneficiaries, and two of the publications there are Medicare and You for the current year. And again, Medicare makes updates in the fall, so you expect the new version of Medicare and You to come out in the fall of each year to tell you about what's going to go into effect with the program beginning January 1st of the following year. And then there's another publication there that's called Your Medicare Benefits, and that's the publication I was talking to you about that just breaks down what you're entitled to under Medicare, including all the preventive health coverage. So Medicare and You has a lot about the basics of the program, and frankly, it can end up reading like stereo instructions sometimes. And so if you want to know the ins and outs of the program, highly recommend, put it by your bedside, great reading. If all you want to know is the benefits I'm entitled to under Medicare, look at that Your Medicare Benefits publication, because again, it just kind of starts with A, with the benefits you're entitled to, goes all the way through Z, and gives you the ins and outs. But really great publications that I would encourage you to at least be familiar with. I think you have to request print copies anymore. Used to, in the fall, all the Medicare beneficiaries just got a copy of Medicare and You in their mailbox. I think it's more an online thing, and then you can request print copies if you need one, but at least bookmark it, download it to your computer or something, and at least be familiar with the basics of the program and the benefits that you're entitled to. Part of being entitled to benefits, as I've mentioned several times in this presentation, is you may still be working. And if you're working after age 65, there could be some confusion about how Medicare works with employer-sponsored health plans. And I actually get a lot of questions about this, and I think we have a question now about it.
I plan to keep working after I'm 65. How will that work with my employer benefits?
It's not going to surprise you, as detailed as this presentation has been, that Medicare has a plan for that also, okay? It's actually quite common now for people to continue to work and maintain employer-sponsored health coverage while also being Medicare eligible. And that's why I've said these two words before, and I'll say them now. That's why Medicare has exceptions for if you maintain creditable coverage, okay, which is coverage as good as what you would get under Medicare, but it's paid for by somebody else. I think the best answer for if you plan to keep working and how does that affect me is to talk to your local human resources person or who processes your benefits, because Medicare does have programs in place where they do coordination of who pays what and when and how and all of these other things. But it's also important for you to talk to human resources or your benefits department to see how your organization handles that. So for instance, I know my organization, when I turn 65, if I'm going to continue to work, I have to enroll in Medicare Part A. I have to take that inpatient health coverage, and then my employer-sponsored health plan becomes a supplement or becomes a secondary payer, okay? So they're basically kind of offloading big time expenses of me in the hospital onto Medicare, and then they're just kind of nibbling around the edges with anything that's left over. But that's only what my employer does. Your employer, while you're still working, may do something different. All the more reason to talk to them and figure out what they do and how they interact with Medicare. But in these instances where there may be multiple payers, including employer-sponsored health coverage, TRICARE for life, workman's compensation, or any number of other payers, there are systems in place for Medicare to coordinate payment of benefits. One is Medicare may just be the payer, right? Like if Medicare is going to pay, your other people may not pay, and that's just how it is. Or the service isn't covered by them or something, and so Medicare is the only payer. Sometimes Medicare may be the secondary payer, which basically means that someone else is picking up the big tab, and then Medicare is just kind of nibbling around the edges, taking care of what's left. And then there may be some instances where Medicare may not pay at all. And so that is maybe a rare instance, but not completely unheard of. The service isn't covered, the justification isn't there, the facility wasn't right, the provider wasn't right, something like that, and Medicare just isn't going to pay. But there are strict structures in place for Medicare to decide who's the payer and how. Now, when Medicare is the primary payer, it's going to take care of those expenses, plus may be able to involve other things like your Medigap policy or Medicaid. So there are people who are known as dual eligibles who are covered under Medicare and Medicaid. There may be benefits through a retirement plan that you're a part of, the Indian Health Service, Veterans Benefits, or TRICARE for Life. Medicare is the secondary payer when it's not responsible for paying a claim first. The Affordable Care Act kind of disrupted the health insurance industry and in a good way. It provided coverage for millions of Americans who may or may not have had coverage previously for a variety of reasons. But Medicare and the Affordable Care Act, or the Health Care Exchange, health care marketplaces, whatever you want to call them, they don't play together, okay? Let me say that again. They don't play together. If you're on Medicare, you don't need coverage through the Affordable Care Act. You don't need to do anything with the health insurance marketplace. And in fact, under federal law, it is illegal for someone to try to sell you a marketplace plan if you are a Medicare beneficiary. And so when you hear about open enrollment dates, which as a Medicare beneficiary, you're going to have open enrollment dates, you're going to have enrollment periods, all of these other things. But when you get the mailers or see the commercials or have someone knock on your door or call you or stop you as you're going to the grocery store and ask you if you are enrolled in a health insurance exchange, or a marketplace plan, just walk on by, hang up the phone, close the door. As a Medicare beneficiary, you don't need to worry about anything with the Affordable Care Act or with the health insurance marketplace.
I'm helping my dad. He currently gets benefits from the VA. Will he be able to use his Medicare benefits as well?
Great question. And I really love that it's coming from a caregiver of someone, because a lot of times, especially as older adults get older, the ins and outs of a benefit program like Medicare can actually become a lot. And so it does fall to caregivers a lot of times to help interpret mom or dad or great Aunt Tilly's Medicare benefits. And it is important for caregivers to understand the ins and outs of Medicare and how different programs work together. The simple answer is Medicare and the VA don't really work together. If you are taking advantage of your VA benefits at a VA facility or other facilities that may be included under some type of waiver that allows you to visit there, that's a new wrinkle in this saga about Medicare and the VA, with people being able to use non-VA facilities under some type of waiver. But if you are accessing your VA benefits at a VA facility, it typically does not involve Medicare. Medicare is not going to pay. Similarly, if you're using your Medicare benefits at a non-VA facility, so just a run-of-the-mill hospital, run-of-the-mill doctor's office, run-of-the-mill clinic, that does not involve your VA benefits at all unless you're working on some type of waiver that allows you to use your benefits at that facility. So both great programs, both serve essential services for a unique population, but they basically operate as two separate programs. And so again, just to recount, you use your VA benefits at VA facilities, you use your Medicare benefits at non-VA facilities. Now, it's up to you what you want to take advantage of and how you want to take advantage of it. So for instance, where I live, there's actually still a full service VA hospital. And so you can go there and get most services that you would get at the non-VA facility that is within sight distance from the VA hospital. It's just a matter of which benefits are you going to take advantage of. And I think it is important to kind of do some consumer shopping, right? To figure out what's going to work best for you, when you're going to be seen, who's going to see you, that kind of thing, just to make sure you jive with the provider, you jive with the facility, and make that informed decision as a health consumer about which program and which service you want to use. Similarly to VA, but more for active duty retirees, Medicare works with TRICARE for Life, but in the way that TRICARE kind of becomes a secondary payer for Medicare, okay? So Medicare pays first, typically, with TRICARE for Life, and then TRICARE for Life will come in and take care of anything extra, right? Nibble around the edges and be that secondary payer. The one difference with TRICARE for Life is that it may be different from other types of supplemental insurance, is that TRICARE for Life may pay when Medicare doesn't. So if Medicare denies your service for whatever reason, TRICARE for Life may still pay for that. And so an instance where this may be the case is, say, that foreign travel emergency where you're not covered under Medicare because you're not standing on U.S. soil or not getting services at a U.S. facility. TRICARE for Life may still pay. TRICARE for Life may also pay for you at like a health facility on a military installation where Medicare typically wouldn't pay for that. And then there is a catch, though. TRICARE for Life does require you to be enrolled in Medicare Part A and B, which is not so different from other types of supplemental insurance for Medicare. But there is a really structured and slick way for Medicare and TRICARE for Life to work together. And for more information on that, you can ask Medicare or you can get in touch with TRICARE to see what those benefits are going to look like in your retirement from active duty service. Similar to coordination of benefits for health services, there are coordination of benefit structures in place for prescription drug services. And so if you're maintaining employer health coverage, if you've got prescription benefits through TRICARE or VA or other entities, Medicare does have structures in place for those types of coordination benefits. And, you know, it's a lot of I before E except after C and these types of ins and outs. And so I don't know that it's important to kind of go through that, but there is information for that in the Medicare guidance, or you can ask your other provider like TRICARE or like your employer to find out how that coordination of benefits works with your particular plan. With all of this, it is important to seek outside help and to get those outside resources. And where do I start? How do I know who to contact? And I think we actually have a question about that.
I need more information on how to enroll in Medicare. What are my options? And where could I find more information?
It's a great question. And the answer is, of course, the unsolicited flyer that comes addressed to resident that comes in your mailbox. No, not at all. The best source of information about Medicare is Medicare. Okay, so go to the Medicare website, call the Medicare 800 number, and talk to those folks about the questions that you have. The Medicare website has come leaps and bounds with getting more friendly, and so I would commend to you, just go poke around on there. You can even create an account, log in, see your benefits. You can access your summary notices. You can check your prescription drug plan. You can do a whole lot of stuff on the Medicare website. And so I would encourage you to visit that. If you're a dual eligible, or if you qualify for one of the income subsidies that may be offered to help offset some of the costs of Medicare, you're going to want to check with your state's Medicaid entity about those amounts. And so you can go to medicaid.gov and then find the Medicaid service in your state to get more information about that. Medicare enrollment is done through the Social Security Administration, as if this process needed to get any more confusing. But you're actually going to enroll in Medicare through SSA.gov. Same kind of deal. Go on to SSA.gov, create an account, check your work history to make sure that they've documented your 40 quarters, so that when you turn 65, you're going to be ready to enroll in Medicare, and you'll actually enroll in Medicare through the Social Security website. So it's important to be familiar with that, but they can give you more information about all of that on the webpage. The state health insurance program are those disinterested third parties that I talked about throughout this session that can help you with evaluating plans, choosing a prescription drug plan, knowing when those open enrollment periods are, the special enrollment periods, your initial enrollment periods, all the alphabet soup that is Medicare. These people can help you. They're typically associated with the Area Agency on Aging, which is something that serves every county in the United States. Now, it may not be in your county. You may have to go a little bit because it's a regional presence. But they have benefits counselors and others that can help you determine what's going to be best for you. They don't recommend, they're not salespeople. They just help you make an objective decision about what's right for you, what's best for you. And then it's still your duty to enroll or to take advantage of that. But they can help you. And so you can find who those people are and where those people are through the State Health Insurance Program, or SHIP website. And then if this video has you just craving way more information on Medicare, like more information than you could possibly digest, and you want to know what Medicare looks like on Tuesdays when the moon is full in an odd-numbered year, you can go through the CMS National Training Program, which starts at the very start with Medicare basics and goes all the way through all the different benefit programs and qualifications and services that Medicare offers. It's a really neat and slick training that can provide you a lot of additional information. And if you're a caregiver or a provider or working with Medicare beneficiaries, or people who are soon going to be Medicare beneficiaries, I would commend this to you as like a professional development or training opportunity, so that you can learn more about the program and all the ins and outs of it. I want to thank you for your time, and thank you for hanging on with us. We covered a lot of information. I always think about, when I talk about Medicare, I always think about Smokey and the Bandit, where they say we got a long way to go and a short time to get there. There's a lot more information out there. We just scratched the surface of Medicare, but we still covered a lot of information. We talked about Medicare as a health insurance program that's basically, especially if we're talking about original Medicare, basically standardized in all 50 states and all the U.S. territories. That covers a lot of health services and costs, but doesn't cover all health services and costs. We also learned that there are programs out there that can help people who meet certain income and asset requirements. And so, again, somebody can't tell you no if you don't ask. So ask. If you think you qualify, if you know you qualify, if you want to qualify based on income and assets for some of that extra help, ask someone. And those counselors at the State Health Insurance Program, the SHIP program, can help you make that determination. There are a lot of choices in how you get your coverage, and a lot of them have deadlines that may have we didn't call them penalties. What do we call them? Surcharges associated with a delay in enrollment. And so we want to pay attention to those deadlines, and we want to make sure we're making those time-sensitive decisions, especially if we're looking to change something, right? Because there may be only a few weeks out of every year that we get the opportunity to change something we're not happy with. So be aware of those deadlines, pay attention to them, because there may be real costs associated with missing them. And then also we learned that Medicare does have programs and structures in place to help with coordination of benefits, so that if I'm getting coverage, whether it's I'm still working through with an entity that provides me employer-sponsored health coverage, or I'm a retiree, or I'm eligible for any number of other benefit programs, Medicare does know how to work with those programs and have structures in place to do so. But being aware of that is going to be very important so that you can be an informed Medicare beneficiary. And with that, I want to thank you for your time. Thank you for your attention. Thank you for your interest in Medicare, whether you're a beneficiary or you're about to be one, a caregiver who's helping one, or a professional who's serving one. It's a great program that does a lot of great things, and your understanding it is going to help you take advantage of all the benefits that you're entitled to under it. So thanks.
Thanks, Dr. Crocker. We really appreciate your time and expertise today and sharing lots of good information for our providers and caregivers. I'd like to really go ahead and touch base on our continuing education credit, as well as certificates of attendance, because that's important for our professionals that are joining us today. We are offering 1 CE credit for several different accrediting associations, but please note, in order to receive that continuing education or certificate of attendance, you will need to complete a survey beforehand in order to receive an automatically generated email certificate. So when you go to our page, you're going to see a nice QR code. Go ahead and put that QR code into your phone or whatever device you're using. Use that QR code. It's going to take you to the event page for today's session, where you will scroll down to the continuing education section. From there, go ahead and click on that purple continuing education button. You will then be taken to a survey. The survey is to let us know how our session was today. Even give us any feedback that you have for us. We like your honesty, how we can make these programs a little bit better for you. But we are offering CE credit for providers, whether they're accredited financial counselors, board certified patient advocates, certified case managers, certified disability management specialists, certified family and consumer sciences, certified family life educators, certified health education specialists, certified personal and family finance educators, certified personal finance counselors, and finally, those that are social workers, licensed professional counselors, and licensed marriage and family therapists. You can receive CE credits for today's session. And as I mentioned earlier, certificates of attendance are available as well. Again, thank you for joining us. Please get connected with OneOp in all of our upcoming events, articles, resources to better support you in your work. Please use the QR code that we have here, where you can access a wide range of free, expert-delivered resources to build your professional skills. Stay engaged with the latest insights and upcoming events by following us on social media or joining our email list to receive webinars and CE opportunities straight to your inbox.